am Tehseen Khan, Assistant Professor at Bhagyodeti Pharmacy College, Sagar. Today, we are going to deal with an interesting and learning episode of B.Pharm on the important title, that is Pharmacology of ANS2 and CNS1. So let's start our episode while taking a look at what we are going to learn today. We will begin with general introduction of the topic, followed by neurohormonal transmission in CNS, adrenergic receptor and neuron blocking agents, drugs acting on autonomic ganglia, general anesthetics and alcohol and disulfiram. Now, let's take a start with introduction of the topic, that is pharmacology of ANS2 and CNS1. So friends, moving to our first module, that is introduction. The nervous system coordinates the activities of many other organs. It activates muscles for movement, controls hormone secretions from glands, regulates the rate and depth of breathing and regulating other physiological processes. To perform these functions, the nervous system relies on neurons, which are designed for the rapid transmission of information from one cell to another by conducting electrical impulses and secreting chemical neurotransmitters. The electrical impulses propagate along the length of nerve fiber, where they initiate a series of events that cause the release of chemical neurotransmitters. Understandings of the nervous system pharmacology. Following aspects are highlighted in this lesson, such as neurohormonal transmission in CNS, adrenergic receptor and neuron blocking agents, drugs acting on autonomic ganglia, general anesthetics and alcohol and disulfiram. Now friends, moving to our next module, that is module number 2. Neurohormonal transmission in CNS. A neurotransmitter is a chemical substance released from the nerves upon electrical stimulation which acts on a specific receptor on nearby effector cells to bring about a response, thus acting as a chemical messenger of neural activation. The neurohormonal transmission in CNS is same as that in periphery. The steps involved in transmission are elaborated in figure 1. Steps involved in excitatory and inhibitory neurotransmission. The nerve action potential consists of a transient self-propagated reversal of charge on an axonal membrane. That is, the internal potential EI goes from negative value through zero potential to a slight positive values primarily through increases in sodium ion permeability and then returns to resting values by an increases in potassium ion permeability. When the AP arrives at the presynaptic terminal, it initiates release of the excitatory or inhibitory transmitter. Depolarization at the nerve ending and entry of calcium ion initiate docking and then fusion of the synaptic vesicles with the membrane of the nerve ending. Docked and fused vesicles are shown in figure number 2. Combination of the excitatory transmitter with postsynaptic receptors produces a localized depolarization. The excitatory postsynaptic potential, that is EPSP, through the increase in permeability to cations. Most notably sodium ion, the inhibitory transmitter causes a selective increase in a permeability to K plus or Cl minus, resulting in a localized hyperpolarization. The inhibitory postsynaptic potential, that is IPSP. Next is the EPSP initiates a conducted AP in the postsynaptic neuron. In this can be prevented, however, by the hyperpolarization induced by a concurrent IPSP. The transmitter is dissipated by the enzymatic destruction, by reuptake into the presynaptic terminal or adjacent cells, or by diffusion. Now, various transmitters in CNS, that is, first is acetylcholine in CNS. where acetylcholine is widely distributed in the CNS. Important pathways include basal forebrain, that is magnocellular nuclei, which sends a diffuse projection to most forebrain structures, including the cortex and septohippocampal projection. Next is certain neurodegenerative diseases, especially dementia and Parkinson's disease, are associated with abnormalities in cholinergic pathways. Next is both nicotinic and muscarinic acetylcholine receptors occur in the CNS. And the other one is noradrenaline in CNS. Noradrenergic cell bodies occurs in discrete clusters, mainly in the pons medulla and locus coeruleus. Noradrenergic pathways run mainly in the medial forebrain bundle and descending spinal tracts, terminate diffusively the cortex, hippocampus, hypothalamus, cerebellum and spinal cord. The next is the action of noradrenaline and mainly inhibitory beta receptors, but some of the excitatory, that is alpha and beta receptors. Next is noradrenergic transmission is believed to be important in the arousal system, controlling wakefulness and alertness, blood pressure regulation, control of mood, that is functional deficiency contributing to depression. Next is dopamine in CNS. Dopamine is a neurotransmitter as well as being a precursor for noradrenaline. It is degraded in a similar fashion to noradrenaline, giving rise mainly to dihydroxyphenyl acetic acid and homovenilic acid, which are excreted in the urine. There are three main dopaminergic pathways. First, nigrostriatal pathway, important in motor control. Next is mesolimbic or mesocortical pathways, running from groups of cells in the midbrain to part of the limbic system, especially the nucleus accumbens, and to the cortex. They are involved in emotion and drug-induced reward systems. Next is tuberohypophyseal neurons, running from the hypothalamus to the pituitary gland, whose secretions they regulate. There are 5 dopamine receptor subtypes, that is D1 and D5 receptors are linked to stimulation of adenyl cyclase. D2, D3 and D4 receptors are linked to inhibition of adenyl cyclase. Most known functions of dopamine appear to be mediated mainly by receptors of the D2 family. Receptors of the D2 family may be implicated in schizophrenia. The D4 receptors shows marked polymorphism in humans, but no clear relationship with diseases has been established. Behavioral effects of an excess of dopamine activity consist of stereotyped behavior or patterns and can be produced by dopamine releasing agents. That is, example, amphetamine and dopamine agonist. For example, apomorphine. Hormone release from the anterior pituitary gland is regulated by dopamine, especially prolactin release, that is inhibited, and growth hormone release, which is stimulated. Dopamine acts on the chemoreceptor trigger zone to cause nausea and vomiting. Number 4 is serotonin in CNS, that is also known as 5-HT. So, 5-HT neurons are concentrated in the midline raphe nuclei in the pons and medulla, projecting diffusively to the cortex, limbic system, hypothalamus and spinal cord, similar to the noradrenergic projections. Functions associated with 5-HT pathways include number 1, various behavioral responses, for example, hallucinatory behavior, wet dog shakes. Number 2, feeding behavior. Number 3, control of mood and emotions. Number 4, control of sleep or wakefulness. Number 5, control of sensory pathways including nociceptions. Number 6, control of body temperature. And number 7, vomiting. 5-HT can exert inhibitory or excitatory effects on individual neurons, acting either presynaptically or postsynaptically. The main receptor subtypes in CNS are 5-HT1A, 5-HT1B, 5-HT1D, 5-HT2 and 5-HT3. Associations of behavioral and physiological functions with these receptors have been partly worked out. Other receptor types, that is 5-HT4 to 7, also occur in the central nervous system. Drugs acting selectively on 5-HT receptors or transporters includes: first is triptans, that is sumatriptans, 5-HT1D agonist used to treat migraine. Number 2, 5-HT2 antagonist, for example ketanserin, used for migraine prophylaxis. Number 3, selective serotonin uptake inhibitors, for example fluoxetine, used to treat depression. Ondansetron, 5-HT antagonist, used to treat chemotherapy induced emesis. Here we can see the table number 1, which shows some other neurotransmitters in the central nervous system. Dear friends, here you can see 3 blocks where transmitter, receptor and effector mechanism. Here the transmitter is GABA, which is an inhibitory transmitter, which binds on the 2 receptors, that is GABA A and GABA B. The GABA A receptor acts by ligand-gated chloride channel, whereas GABA B receptor acts by G-protein couple receptor and inhibition of adenyl cyclase. The next transmitter is glycine, which is an inhibitory transmitter, which acts by ligand-gated chloride channel. The next is glutamate and aspartate, which is an excitatory neurotransmitter, which comprises or acted on 4 receptors, that is NMDA, AMPA, kainate and metabotropic. Here NMDA, the receptor, its effector mechanism is binding with ligand-gated cation channel, which slows kinetics, high calcium ion permeability within the cell. Next is AMPA, which effector mechanism is ligand-gated cation channel, which shows fast kinetics channel possessing GLU-R2 subunits, shows low calcium ion permeability. The kin receptor, its effector mechanism is ligand-gated cation channel, which shows fast kinetics and low calcium ion permeability. The last one is metabotropic, which effector mechanism is G-protein coupled, that is inositol triphosphate formation and release of calcium ion. Now friends, let's come to our next module, that is module number 3, adrenergic receptors and neuron blocking agents. The peripheral adrenergic neuron is an important target for drug action, both as an object for investigation in its own right and as a point of attack for many clinical useful drugs. In this chapter, we describe the physiology and function of noradrenergic neurons and the properties of adrenoreceptors and discuss the various classes of drugs that affects them. So, classification of adrenoreceptors. Mainly, adrenergic receptors are classified into alpha and beta subtypes. The adrenoreceptor subtypes contain: number 1, 2 main alpha receptor subtypes, that is alpha 1 and alpha 2. Each divides into 3 further subtypes. Number 2, 3 beta adrenoreceptor subtypes such as beta 1, beta 2 and beta 3. Second, messengers. Number 1, alpha 1 receptors activate phospholipase C producing inositol triphosphate and diacylglycerol as second messengers. Number 2, alpha 2 receptors inhibit adenyl cyclase decreasing CAMP formation. Number 3, all type of beta receptors stimulate adenyl cyclase. Main effects of receptor activation are as follows. Number 1, alpha 1 receptors vasoconstriction, relaxation of gastrointestinal smooth muscles, salivary secretion and hepatic glycogenolysis. Number 2, alpha 2 receptors inhibition of transmitter release including noradrenaline and acetylcholine, release from autonomic nerves. Platelet aggregation, contraction of vascular smooth muscles, inhibition of insulin release. Number 3, beta-1 receptor, increased cardiac rate and force. Number 4, beta-2 receptors, bronchodilation, vasodilation, relaxation of visceral smooth muscles, hepatic glycogenolysis and muscle tremor. Number 5, beta-3 receptor, that is lipolysis. So dear friends, here in a table number 2 you can see the receptor, that is alpha 1, alpha 2, beta 1, beta 2 and beta 3. So the tissues and their effects. The effect of smooth muscles such as blood vessels which constrict at alpha 1 receptor, at alpha 2 it constrict or dilate, and in beta 2 it dilates. Next, bronchi, at alpha 1 receptor it constrict and dilate at beta 2 receptor. Next is gastrointestinal tract which relax at alpha 1 receptor, at alpha 2 it relax at presynaptic effect and relax at beta 2 receptor. Next is gastrointestinal sphincters which contract at alpha 1 receptor and give no response on the other. Now coming to next, that is uterus, it contract at alpha 1 receptor and relax at beta 2 receptor. Bladder detrusor, that is it gives the relaxation at beta 2 receptor. Next is bladder sphincter which contract at alpha 1 receptor and with no response on the other receptors. Next is seminal tract, that is which give the contraction at alpha 1 receptor and beta 2 receptor gives the relaxation. Next coming to the iris, that is radial muscle, contraction at alpha 1 receptors. Ciliary muscles, relaxation at beta 2 receptor. So friends, coming to next, that is heart. The heart rate increases at beta 1 receptor and also increases at beta 2 receptor. Force of contraction increases at both the beta 1 and beta 2 receptor. Skeletal muscles, when bind to beta 2 receptor, causes tremor, increased muscle mass and speed of contraction, and glycogenolysis. At beta 3 receptor, it causes thermogenesis. At liver, glycogenolysis at alpha 1 and beta 2 receptor. Fat give lipolysis and thermogenesis effect on beta 3 receptor. Next is pancreatic islets, that gives alpha 2 receptor, causes decreased insulin secretion. Now friends, coming to the nerve terminals, that is adrenergic which decreases the release at alpha 2 and also increases the release at beta 2. Next is cholinergic which decreases the release at alpha 2. Next is salivary gland which releases potassium ion at alpha 1 and increases the amylase secretion at beta 1. Next is platelets which aggregation cause at alpha 2. Next is mast cells. It causes inhibition of histamine release at beta 2. Coming to the next, that is brain stem which causes inhibition at sympathetic outflow at alpha 2 receptor. Second, messengers and effectors. Here at alpha 1 position or alpha 1 receptor, it gives phospholipase C activation which causes increase in inositol triphosphate, also causes increase in diacyl glycerol which causes increase in calcium ion, thus the cell stimulate. The next is second messenger and effectors also at alpha 2 receptor which decreases the CAMP, decreases calcium channels and increase the potassium channel. At beta 1 receptor it increases CAMP, beta 2 it also increases CAMP and beta 3 it also increases CAMP. Agonist potency order. Here NA, which means noradrenaline, is greater than adrenaline, is greater than isoprenaline. The next is alpha 2 where adrenaline is greater than noradrenaline and which is greater than isoprenaline. At beta 1 receptor, isoprenaline is greater than noradrenaline which is greater than adrenaline. At beta 2 receptor, isoprenaline is greater than adrenaline which is greater than noradrenaline. At beta 3 receptor, isoprenaline is greater than noradrenaline, which is equals to adrenaline. Here friends, coming to next, that is selective agonist, such as alpha 1 receptor phenylephrine methoxamine, alpha 2 receptor clonidine clenbuterol, beta 1 receptor dobutamine zemoterol, beta 2 receptor salbutamol terbutaline salmeterol and formoterol, beta 3 BRL 37344. Next is selective antagonist, such as at alpha 1 prazosin doxazosin, alpha 2 yohimbine idazoxin. Next is at beta 1 atenolol metoprolol, at beta 2 butoxamine. Adrenergic neuron blocking drugs are classified as follows. Number A, that is drugs which prevent release of noradrenaline, for example guanethidine, guanadril and beryllium. B, drugs that inhibit storage of noradrenaline, for example reserpine. C, drugs that interfere with synthesis of noradrenaline, for example metyrosine. Guanethidine is a polar guanidine compound which is taken up into the adrenergic nerve endings by active amine transport and has three important actions. A, displace noradrenaline from storage granules. B, inhibit nerve impulse coupled release of noradrenaline. C, engages and block noradrenaline uptake mechanism at the axonal membrane. Here come with the pharmacological effects. First, CVS causes decrease in blood pressure and decreased TPR as well as cardiac output. 2. GIT blocks sympathetic activity, increasing the parasympathetic activity, which leads to increased motility of gut. This might result in abdominal cramps or diarrhea. Number 3. I. Parasympathetic sphincters has unimpeded action causing meiosis. Decrease in intraocular pressure is also observed. Number 4. CNS. Drug does not cross BBB, so has no effect. So friends, coming to our summary section. Summary. In this chapter, we describe the physiology and function of noradrenergic neurons and properties of adrenergic receptors. The noradrenergic neuron is an important target for drug action, both as an object for investigation for many clinically useful drugs. Here, we describe the different type of ganglion modulating agents. So friends, we will see other topics such as drug acting on autonomic ganglia, general anesthesia and alcohol and disulfiram in our next episode. Friends, I will be back with few more lectures in the series. Do keep in mind what we discussed today. Time for you to self-study. If you want to learn more and enhance your knowledge, you may log on our website for MCQs, quiz, LORs at www.cec.nic.in. Till then, keep studying. Goodbye. Thank you.
Thank you.